Now we're going to briefly talk about the sternum. Our chest plate. This sternum here is plastic and it has costal cartilages attached to it. Costal cartilages are hyaline cartilages and they connect the sternum to the ribs. The top portion of the sternum is known as the manubrium. And here actually I got one that is real and has the first rib attached to it because it was ossified. So the manubrium is the top portion of the sternum and it has a jugular notch on top, and then right on the side we have what we know as clavicular notches because the clavicles will come in right there and attach to it. Then right underneath we have where the first rib comes in, and on this specimen we do have the first rib coming in. Then we have a place where the manubrium attaches to the body of the sternum.
That is known as the sternal angle.
Can't really make it out here, but it's right here below, right above the area where the second rib comes in. And that's the body of the sternum where the ribs attach, mainly rib 2 through rib 7. And then on the bottom tip we have what's known as the xiphoid process. That's another part of the sternum. When we look at ribs and rib attachments, we have 12 sets of ribs, and we have the first 7, they're true ribs, and they are right here. 1, 2, 3, 4, 5, 6, 7. And then rib 8 through rib 10 are known as false ribs because, and it doesn't show that nicely here, but because the cartilages of those ribs will attach to the cartilage of rib number 7 before it comes into the sternum. And then we have 2 ribs at the bottom, and those are known as free floating ribs because they do not attach to the sternum. When we look at a rib, we look at that C-shaped bone, and one end sort of just fizzles out. And that's the end that will come into a costal cartilage that goes into the sternum. That end is known as the sternal end. Then it shapes around, and on the other side we have a couple of bumps. And the first bump is called the head of the rib, or rib head, and that will articulate with the costal demifacets of the thoracic vertebrae, the bodies of the vertebrae. Then we have a slender region, and that's the neck. Like in our own head is round and the neck is slender mostly. And then we have a tubercle, and the tubercle will articulate with the transverse process of the thoracic vertebra, or the costal facet at the transverse process of the thoracic vertebra. Trunk muscles. So the first one I want to talk about are the external and internal intercostal muscles. And the external and internal intercostal muscles we can see right here. These here are the external intercostals, so they go from the inferior border of the rib above to the superior border of the rib below. And what they do is when they contract, they pull the rib up and out a little bit, so that will make the rib cage go up and out a little bit, and that aids inspiration when we breathe in. The main inspiratory muscle is the diaphragm. The diaphragm is actually right here, this border right here that is indicated here, that's the border of the diaphragm. Then we go to the abdominal muscle wall. The whitish sort of sheath that is covering the whole abdomen is known as the abdominal aponeurosis. Then where it comes together in the midline, right in here, is known as the linea alba. When we go from deepest to most superficial, let's turn that first around. The first muscle we have is a muscle that runs transverse right here. And that muscle is known as the transversus abdominis. And then we get the internal oblique muscle, and that one is on this side. On the opposite side is the external oblique that is indicated on this side. And if you look at the way that the fibers go, the muscle fibers, the external oblique goes this way, the internal oblique goes this way. So you can remember that easily, that the external oblique are like you put your hands in your pocket. That way. And then most superficially we have the rectus abdominis, also the six-pack muscle.